Okay, so you've just been through surgery, and now the really important work begins, your recovery. We've put together this guide to help you feel confident and in control over the next few weeks.
You've already done the tough part, really. Now it's all about healing up comfortably and safely. Think of this as your simple, straightforward action plan. So let's jump right into the first thing, which might actually surprise you.
First up, let's talk about food. I know, it might not be the first thing on your mind, but believe me, what you eat plays a massive role in how you feel and how well you heal after this kind of surgery. So, what's the number one goal here? It's simple. We have to keep your bowel movements soft. This is so important because it prevents straining and cuts way down on pain at the surgical site. And that's exactly what we want. And the best way to do that? With fiber. You'll want to gradually, and I mean gradually, start adding things like oats, brown rice, fruits like pears and prunes, lots of veggies, and legumes like beans and lentils to your meals. But here's the catch, and it's a really important one. Fiber can't work its magic alone. It's like a sponge. It needs to soak up water to create that softness. If you load up on fiber but don't drink enough, you can actually make constipation worse. So staying hydrated is absolutely non-negotiable. So, how much water are we talking about? Well, the magic number is about 3 liters a day. That's roughly 10 glasses. I know, it sounds like a lot, but it is the secret ingredient to making this whole process go smoothly. Now, just as important as what you eat is what you don't eat. For a little while, you'll want to steer clear of spicy foods like chilies. They can cause a pretty nasty burning sensation. Also, try to limit things that can back you up, like a lot of cheese, red meat, and processed foods. And finally, it's a good idea to minimize alcohol and caffeine, just because they can dehydrate you. And one last thing on this, you have to be proactive. Your doctor probably prescribed a stool softener. Take it exactly like they told you to. The whole point is to prevent constipation before it starts, not to chase after it once it's already a problem. Okay, let's move on to our second key area, hygiene. This is so important. Keeping the area clean is your best defense against infection, and honestly, it's a huge part of just managing your comfort day to day. This is incredibly important, so listen close. After a bowel movement, please avoid dry toilet paper. It's just too rough right now. Instead, use water. A handheld shower head on a gentle spray or a bidet is perfect. That's step 1. For step 2, do not rub the area dry. Just gently pat with a clean, soft towel. You can even use a hairdryer on the cool setting. Seriously, it works. All right, now let me introduce you to your new best friend for recovery, the sitz bath. It's basically a shallow soak in warm water, and it does 3 amazing things. It cleanses the area, it soothes pain, and it helps relax all those muscles that can get super tense after surgery. This simple little routine can make a world of difference in how you feel. So let's break down exactly how to do it right for the best results. Okay, first, the water needs to be warm, comfortably warm, never hot. Second, just use plain water. Don't add anything unless your doctor specifically told you to. Third, you'll want to soak for about 10 to 15 minutes. And finally, the most critical part is how often you do it. 3 times a day, plus an extra one after every single bowel movement. Yes, every single one. This routine is absolutely key. Okay, this next part is not to make you worry. It's all about empowerment. Knowing what's normal during healing and what's a red flag gives you control and makes sure you get help right away if you need it. This is your safety net. So, what are the specific signs that mean you should pick up the phone and give your doctor's office a call? Let's get really clear on this. Call your doctor right away if you notice excessive bleeding or past large clots, and pay close attention to these numbers. If you get a fever over 104 degrees Fahrenheit, that's 38 Celsius, that's a reason to call. Same goes if you realize you haven't been able to urinate for 6 to 8 hours. Other urgent signs are pain that your prescribed medication just isn't touching, or any kind of foul-smelling discharge or redness that looks like it's spreading. Whew, we have covered a lot of ground. So to make it all easy to remember, we've boiled it down to a simple, powerful checklist for you to follow every day. This is your game plan. So look, it all comes down to 4 core habits. If you can focus on these 4 things every day, you'll be in great shape. Drink your 3 liters of water. Take your stool softeners as prescribed. Do your sitz bath 3 times a day, plus after every bowel movement. And get in about 3 good servings of fiber-rich food. Nail these 4 things, and you are setting yourself up for a much smoother recovery.
And remember, be patient and be kind to your body while it's healing. You've got this. We're all wishing you a very comfortable, smooth, and speedy recovery.